Tomorrow, December the 1st, is World AIDS Day, an annual day to acknowledge those we've lost to AIDS-related conditions and those who are living with HIV. The theme for World AIDS Day 2020 is Now More Than Ever. Since the first HIV diagnosis in Australia more than 30 years ago, our understanding around prevention, transmission and treatment of HIV has improved dramatically. But despite the investment resulting in extraordinary advances in all of these areas, there is still more to do. As we fight to wrestle this terrible disease into extinction, now more than ever, we need to ensure that the advances we have achieved are not lost. Now more than ever, we need to ensure that those who need treatment can get it. Now more than ever, we need to ensure that those who are at risk of disease take steps to prevent getting it. And now, more than ever, we must protect against stigma that still exists within our communities to help save lives and to help protect lives. Mr Deputy Speaker, Higgins is vibrant and diverse, and we have communities that include many from the LGBTQI+ community. I'm proud to represent them all. I work with many LGBTQI+ community groups, including great advocacy groups like Thorn Harbour. I'm proud to be a member of Liberal Pride. Higgins is also home to world-leading HIV/AIDS research. Professor Sharon Lewin, the director of the Peter Doherty Institute for Infection and Immunity, and also a local constituent, has been a leader in HIV/AIDS research. She leads a multidisciplinary research team working on mechanisms of HIV latency, clinical trials advancing potential HIV cure strategies, and how HIV is affected by co-infections such as hepatitis B. She was central to bringing the International AIDS Conference to Melbourne in 2014 and was local co-chair. I'd like to also acknowledge the hard work of Professor Brendan Crabb AC, the director of the Burnet Institute, which is on the border of my electorate of Higgins. The Burnet's world-class sentinel surveillance system, Access, is now rolled out across state and territory and is being used to monitor HIV-related outcomes during the COVID pandemic. Mr Deputy Speaker, at the end of 2018, 28,000 people were living with HIV infection in Australia. In the same year, there were 833 new HIV notifications, the lowest number since 2001. Of those diagnosed with HIV, 96% were receiving care and 89% were receiving retroviral therapy. Most importantly, 95% of those receiving therapy had a suppressed viral load. This means that Australia has comfortably reached the UN AIDS 2020 target that more than 73% of those living with HIV have a suppressed viral load. This is an immense achievement that this country should be proud of. We should be also proud of the PBS access to preventative treatment called pre-exposure prophylaxis, or commonly as PrEP, that we provide to people at medium to high risk of HIV infection. By listing PrEP on the PBS, 32,000 Australians are subsidised each year. Without this subsidy, they would pay $2,500 per year, a cost that would be beyond the capability of many young patients. Mr Deputy Speaker, HIV can be a soft, sensitive topic for many. So many in the LGBTI community have faced years of homophobia and inaccurate information regarding risks of developing HIV and AIDS. It can be a topic some don't want to openly talk about. In 2020, a national survey of men who have sex with men found that 21% of participants reported feeling stigmatised within the past year by other people assuming they had HIV. Another survey of the Australian public found 30% of participants reported they behaved negatively towards people living with HIV. This shouldn't be happening. There should be no shame. That's why we need to talk about AIDS openly. Mr Deputy Speaker, we are fortunate to have one of the best healthcare systems in the world. As a government, we are fortunate to have the trust and respect of the Australian public as we seek to keep us all safe from emerging health threats. After all, Mr Deputy Speaker, now more than ever, we all need to work together to help prevent and treat AIDS. Thank you.
Order. I thank the member for Higgins. The question is that the motion be agreed.